We're live.
Are we? That's cool. Hi, everyone. So we are the Holistic Vet Sisters. At least we are the initial three. There's going to be more lovely Holistic Vet Sisters that are going to be joining us as the weeks and the months roll by. The idea for the Holistic Vet Sisters is that we provide a service for you to ask us questions about your dogs, your cats, maybe even other pets down the line, depending on who joins us, of course. And the aim is to provide answers from a natural perspective, a holistic perspective, and perhaps even support you with things like diet as well and homeopathy, and just have a chat really about the holistic framework that we have to work with our pets as well, and how you can access the help that you actually need to find for your pet. So we're really excited to do this, and we wanted to, as women as well, we wanted to bring as many women in and offer as many different opportunities to you really to learn from all the wonderful female holistic vets, all the sisters out there that can help you. So we're really, really pleased that you want to be part of it, that you want to watch it, and that you're here. Tina's going to be keeping an eye for us on the questions as they come through. We've already had quite a few questions, so we're going to dive into those soon. But in the meantime, I think it's nice for us just to say a quick hi and who we are, because I think some of you know me, that's why you're here. Some of you know Lise, some of you know Tina. So just for tonight, just a quick hi and who we are. Do you want to start, Lise?
Sure. I'm Lisa. I'm Danish, but I've worked and lived in the UK for a long time as well. I'm a vet, of course, and have been for a very long time indeed. And I'm a classical homeopath, and I've now left conventional first opinion practice, and I have for quite a long time worked just as a specialist treating animals with homeopathy. And I've written a book. Can I show you my book? I've written a complete book of cat and dog health. That's me.
We'll have to talk about that a little bit more, that book, I think, because it's a very valuable book for people to get hold of. It's a great Christmas present.
Oh, there you are. Yes.
It will be a great Christmas. Yeah. A lot of the questions that you'll ask us are probably in that book, to be fair.
That'll be my one answer. It's in the book. Yeah.
Yeah. Grab the book. So, Tina.
Yes. So my name's Tina. I'm from Norway. I also studied abroad, and I've worked in England as well. I did my acupuncture degree at the same time as I finished up my studies. So I practice traditional Chinese medicine or veterinary medicine. Currently, I'm living in Norway. I'm doing still conventional medicine, but I try to integrate as much integrated medicine as possible in my daily practice. I do acupuncture on small animal and horses, and I am finishing up my nutrition degree as well. And I have some more interesting things coming up in the future as well. So yeah, continue learning and sharing information.
We were saying just before we started that you might be the only holistic vet practicing in Norway, we thought.
Might be, actually. Yeah, I'm not aware of anyone.
That's fantastic. I've been looking for literally for decades. I've had, requests from Norway and Sweden, and I've been actively looking and asking around for a holistic vet in Norway, and I've not found any. And now there is Tina. So it's really something that, yeah, absolutely, the go-to person in Norway, and possibly Sweden too.
Yeah, because over here in the UK, we often think that it's quite tough to find a holistic vet, but we're quite blessed actually. Got a lot more than some countries have.
I think Scandinavia is particularly hopeless when it comes to holistic medicine, really. Everywhere else is better than Scandinavia in terms of finding holistic practitioners.
Well, I speak a bit of Swedish, so you never know. Maybe we can help. That's what we're here for, the Holistic Vet Sisters. Okay, I'm Caroline, so I'm not a vet, but I am a pet industry nutrition consultant and have been for over 20 years. So yeah, don't claim to be able to talk about the same things as Lise and Tina, but that's kind of why I'm here, I think, isn't it? So I have recently founded something called the APNC, And this is the Association of Pet Nutrition Consultants. And we are hoping to work with the RVC to have pet nutrition consultants as paraprofessionals, recognised paraprofessionals. And if you head to the APNC website, you can read more about the APNC. And if you are practicing as a nutrition consultant anywhere across Europe, maybe even the world, and definitely in England or the UK, then you need to speak to us about joining the register. It's not very much to join. And if you feel that you want to take the mentorship and understand more about formulation and the small animal clinical nutrition guide, then you can work with us on that as well and improve your knowledge before you become a registered associate. So yeah, that's me. I also, as you know from the little blurb that we did, I run retreats for dogs and their guardians. So I'm very much into de-stressing and the amazing power that de-stressing can have on the body, the mind-body connection, mind-body-soul connection. So that's part of the work that I do as well. Very often I will have a nutrient or nutrition consultant and I will end up offering one of my canine hypnotherapy audios to the dog, which often has more of an impact sometimes than the food changes that we make. So yeah, lots of ailments are related to anxiety and stress for your dog. So the more we can understand that, I think the healthier they are all going to be.
And I think there were questions about diet, if we're going to dive in. I think Caroline is the obvious
Okay, I can start with them.
Maybe we should mention about the Natural Dog Expo.
Oh yes, yes.
Yes, we can do that now if you want. Yeah. So yeah, part of my passion for supporting getting the knowledge about fresh feeding and out there is to run an event, an annual conference, which is held in Birmingham in the UK. We've ran 2 of them, have about 300-ish people at these events, and there's another one happening on Sunday, April the 27th. We have some great people speaking. So Dr. Sue Armstrong, who is a fabulous homeopathic vet, and we have Dr. Connor Brady. We've even this time bringing Rodney Habib over. So yeah, we're going to be talking about canine nutrition, natural dog care. Yeah, be at the event, have a Google. Natural Dog Expo. It's going to be really amazing. Actually, Lisa, you spoke at the first one.
Yeah, I was going to say I spoke at the first one, and I mean I've spoken at lots of events, but the atmosphere there was just amazing place to be. For anyone who loves dogs, it's the thing to do. And if you want to give yourself a Christmas present or make a Christmas wish for your wish list, then going to Birmingham at the end of April for the Natural Dog Expo would be a fantastic Christmas present for anyone who likes dogs. It was a real buzz. There was a fantastic crowd there.
Yeah, absolutely. So much fun. Oh, you were at the second one, Tina, weren't you?
Yeah, you put me on speaker.
I did. I was like, come on stage.
Yeah, no, honestly, I was just, I come from kind of like outside where no one is interested in natural health, and it was just like kind of like coming home. It was just like everyone had the same passion and view of life as myself, and I felt so included. And yeah, I absolutely recommend anyone with an interest in holistic health for dogs. It's amazing, and you'll make so many friends.
And that's the thing, when you go to something like that, even if you show up alone and you don't know a single person, within 2 seconds you're part of a group because you share something that's a big part for most of us, a big part of our lives. Just being interested in dogs, and yeah, it's a place to be.
Yeah, and I think that's one of the reasons we wanted to unite the Holistic Vet Sisters as well, so that we're supporting each other and then supporting guardians at the same time. I'm going to hit record now before we start the questions. So this will stay live on the page for those that are watching, or if you want to watch it on later, show it to somebody else, it will still be live on the page, but I'm going to record it to my computer as well, just so that we've got it.
Okay. All right, you guys ready for the questions?
Yeah, I think so.
So we got quite a lot of questions in, to be honest. So we might even have questions running into the next Thursday. So the first question is from Anna. She's asking, why can't some dogs or puppies digest bone? bones. I've had 2 dogs out of 5 who can't digest bones. Fragments come out as they were chewed. They've been fed raw from they were like 12 weeks old. I really want to feed raw again, but I stopped eating due to all the supplements that ended up in the food then because she couldn't eat the bones. So I guess this is a good starter for Caroline, our experienced nutritionist.
Okay, so it sounds like a couple of questions in one, really, doesn't it? It's just pick it apart a bit. Okay, so I'm guessing what's happened here is the supplements have been added to replace because the bone wasn't then in the raw food that the dog was eating. That's what I'm going to take this as, but it might be slightly different with the supplements. But so in terms of a dog eating raw bone, dogs are supposed to eat raw meaty bones. So raw meaty, the meaty being the bit we remember as well as bone, because it isn't just about raw bones. They're supposed to strip. So really having a raw meaty bone and stripping all that meat off it is the ideal way to feed a raw diet. So that's what you're kind of aiming for. So often the types of bone that a dog would need to be eating to do the stripping would be a different density of bone than that which ends up in raw pet food that we buy that's been minced for us. So the entire carcass would be minced usually. And when your dog is eating a raw meaty bone, they would leave parts usually. So they wouldn't necessarily be able to manage all the different densities of that carcass, depending on the dog, of course, because every dog's going to be different. So I think what can happen in the pre-made dog foods is that much denser bone can be in the product, which for many dogs, that's fine, and they can deal with that. But for some dogs, they can't. So I would wonder about the type of bone, first of all, rather than considering that your dog can't have bone at all. That would be my first consideration for that. Now, it could be that your particular dogs had a reduction in their ability to actually break down the bone and to digest that and in the stomach. So perhaps their stomach acid needed some support for whatever reason that might be. And that would then be a chat with a holistic vet or perhaps a long consultation with somebody like myself or somebody from the APNC to determine what's going on with their stomach acid levels, because there might be something going on there. I would say it's more likely to be the first thing I said, but it could be the second. So that's worth considering as well. And you can add bone meal in. So if your dog is totally unable to have bone content in their food, how it primarily would probably affect them on a day-to-day basis would be the stool quality. So you might find the stools weren't as easy to pick up. Those of us that feed raw and the dog is quite okay with bone, we pick up the stools quite easily, don't we? Whereas if they're not having as much bone, the stool doesn't tend to be as dry. So I think that would be the first way that you'd see it affecting. Now, as I said, you can add bone meal in. You might not have exactly the same effect. You'd have to play around with the amounts. But in terms of the calcium and phosphorus levels, again, it's worth talking to a canine nutritionist, a qualified one, especially one from the APNC, of course. But you can feed, now people don't always know, but tripe, good tripe has the ideal calcium phosphorus balance as well. So if you're aiming for a calcium phosphorus balance and your dog can have tripe, you can as well include tripe in their diet to try and support them in that way. In terms of other supplements, do you think that the question is also meaning that more supplements had to be added to any raw diet than the Guardian Anna was happy to provide, or perhaps could even afford to? I mean, some of these supplements can be expensive. For me, if it is that you felt that raw needed too much supplementation for you to be able to feed that efficiently and be able to economically afford it, I would be questioning why all those supplements were there. So a dog doesn't necessarily need heaps of supplements. If you're using whole foods in the appropriate ratios, the dog shouldn't need lots of supplements. There are some nutrients based on the FEDIAF guidelines or the nutrient requirement guidelines that won't be in an 80-10-10, for instance. Now, that's only based on those guidelines. So it does depend on how you feel about those guidelines. Now, they are all we've got. So based on them, you would need to be adding vitamin E. You would probably need to add zinc, depending on the meat type, because some are higher in zinc than others. You would probably need to add a bit of choline, maybe some iodine. You would need to add omega-3, if I didn't already say that one. So yeah, there's a few bits and pieces that you would need to add in, which can be done easily with either algae or fishes. Adding eggs, broccoli sprouts are terrific. Wheatgrass is absolutely wonderful. Anyone who knows me knows I'm a big fan of wheatgrass, because wheatgrass is anti-yeast and yet provides loads of vitamin E, loads of zinc. It's fantastic. If your dog can't have veg for any reason, you can use wheatgrass instead. So you shouldn't actually need a lot of supplements. Really, supplements are great, really, if there's an issue or an ailment that you're trying to move away from or move through in the nicest way for your dog and support them. Perhaps you're supporting their liver while they have to have veterinary medication for any reason. So they're great for that reason, but I don't think we should just have our dogs on them. We should be looking at food primarily. And I think it is quite simple to feed fresh food without adding too many supplements.
Thank you. I was hoping you would say that. I think there is a risk of over-complicating feeding a healthy dog, you know.
Yes.
Just give them food. Yes, it doesn't have to be complicated.
But do you know what I find as well is that the majority of us have no idea that actually meat with a bone content so like an 80-10-10 has about 96-97% of what a dog needs most of the time. Like, and people are going, wow, I'm not giving them what they need. And it's like, well, to be honest, you like virtually they're just with that, let alone adding some other lovely bits like your fish and your eggs and your broccoli sprouts, you know, or your wheatgrass.
Yeah, but and sometimes in the same family where people are becoming really worried about feeding the dog and what supplements and talking about levels of this and that, then it comes to their kids' mealtime, they just give them food. You know, they don't know what they're not. It's crazy that we can become very alienated from just that sort of the feeling that we know how to care for a dog. We just give them food that makes sense. And that's in most cases for a healthy dog, certainly a healthy adult dog, you don't really have to analyze. You just have to give them something that feels right, the same way you would yourself or your kids.
The other thing as well is when and if we're feeding fresh food in its raw state, or even if in its lightly cooked state, to be honest, we're often then not feeding things like anti-nutrients, like the phytic acids that would be in a processed food, or the refined oils that might be in that food, these have an interplay in the body that they would actually stop the good nutrients from getting to where they need to go. So, you know, often we might say to ourselves, oh, well, we're going to switch on to processed food because then we absolutely know that they're getting what they need. And in fact, even if those nutrients were all fully bioavailable, which I've yet to see a processed food that has got fully bioavailable everything, find me it, because I don't think it exists. Even if they were, they've got other ingredients in them which affect the dog's body in different ways. That means that they end up needing more nutrients to combat that. So they might create inflammation, and then they would need more antioxidants and more supplements even, perhaps, to combat that. So there's this kind of give and take with processed food all the time. Whereas with fresh food, not only are you, with just an 80-10-10, are you almost feeding everything they need, you're not feeding the stuff that could be detrimental.
But do you not find, Caroline, that when people move on to a raw diet or a home-cooked diet, that quite often they will say, we just give a little bit of of kibble as well, just to make sure they get everything they need, which is so bizarre.
Yeah,
but it just illustrates how alienated we've become, or how distant we are from, you know, trusting.
Yeah.
Food.
Yes, I get that. I mean, it's like the vision is that you're throwing vitamins on. In fact, what you're really doing is throwing on something that hinders your dog to absorb the nutrients from the meat. Like anti-nutrients, you know, being thrown on the food. Yeah, I do get that. I mean, the thing is, it's a big subject, the different things. And the body is so adaptive. The dog's body is phenomenal. It will constantly try to reach homeostasis. So this is why people say, oh, he's fine on that. He's fine on that. Well, he might be fine because he hasn't got symptoms, but you don't know what's going on inside. That dog's body will be working super hard to maintain homeostasis, to maintain balance, to maintain microbiome balance, to clear the liver. It'll be working so hard. There will be things happening internally that you may not see for years, but when you do see it in years to come, you'll be looking for a holistic vet. You certainly will be. So better to be preventative, I'd say.
Yeah, I would might add, or to back to the question, that she's saying that they cannot digest bone, and it makes me wonder what made her think that they cannot digest bone, because if it's, you know, small bone fragments in the stool, it's actually quite normal. So the question is, you know, how big are the fragments? Is it actually an intolerance, or is it normal? Because you do get small fragments in the stool normally in healthy dogs, not necessarily.
You can do, but I think you get it more with the created ready-made foods than you would with a dog that's eating raw meaty bones and stripping those raw meaty bones, because they're quite selective and they kind of know what they can and can't cope with.
But I find also that some dogs will be very good at eating bones, and they will kind of nibble them and make sure that they almost destroy the bone as they eat it, and other dogs will be more glutinous and they will just, you know, swallow bigger chunks.
Yes,
couldn't it just be that it's a dog that's so eager that it's not, you know, that it's just swallowing bigger bits of bone?
And it could be that we need to consider the stomach acid. There could be some other things happening there going on with the stomach acid, but you know, from the sounds of it, if they were raw fed from young, that's not likely to be as much of an issue. It does depend on the fat and protein ratios in that food. There's so much we could say about this. We could be just talking about this topic until 7 o'clock, I think.
But this is the thing, when you speak to people who treat holistically, every answer starts with, well, that depends on.
Yeah, exactly. I know. Yeah, absolutely. Yeah.
It's hard to answer questions online because you have so many things to go through about the history, because every patient individually, it's not like just like a yes or no answer, or like one shoe fits all kind of approach.
No, that's the whole point, isn't it? Each case is unique.
Yeah, absolutely. So yeah, I think there's a lot of different causes if they actually cannot digest bones properly. If, you know, in older dogs, if they're starting to get, you know, enzyme deficient, or if there is something wrong with the gastric pH or the production of stomach acid, anything wrong with the motility. I mean, there can be so many things behind this, but I think first thing to look at is there actually a problem, or is it just that they don't chew it properly or something like this? And then in the end, I think if you cannot, you know, feed them raw meaty bones for some reason, you can consider bone meal or like pre-made raw that I've already mixed in the bone.
Better blended raw than perhaps the one that was being fed at the time. Could be. Yeah. See, you're great, Tina.
All right, shall we get over to the next question? So we had a lot of questions about female dogs and their reproductive system. So let's start with how to support a female through a season and phantom pregnancy. Lisa, I think you really wanted to talk about
this. No, it's just the hot topic at the moment. The thing, if I can just give a little bit of context to the whole talk about intact dogs, because this is really, I mean, this is just the topic of the year. What has been happening, and I'll try to make this short, is that historically we haven't really, by we, I kind of mean the dog owning community and vets particularly, have not really paid much attention to the whole you know, decision about whether or not to neuter. It's just been something that wasn't really thought about, and something you either did or didn't do, primarily depending on where you lived. In Norway, you don't neuter. It's illegal to neuter dogs in Norway for other than health reasons. In Sweden, it's very uncommon. It's not illegal, but it practically doesn't happen. You know, high 90% of dogs are intact. And then the rest of Europe is, as far as I can see, pretty much sort of 50-50, maybe a bit more, maybe a bit less. But in the States, almost everybody's neutered. It's been a mantra over there that you must spay and neuter your dogs to be a responsible dog owner. So I find that so interesting that it's something that was mainly culturally dependent. You know, it was just either what you did because it's what everybody did, or it's something that was illegal, but people just lived with it, and it wasn't thought about. And then pretty exactly 10 years ago, this first study appeared that showed, and it was just a real shock. An article was published that showed that neutered dogs have markedly higher risks of developing a long range of diseases that they started out highlighting a higher risk for cancers, cruciate ligament disease, and osteoarthritis. And that really just made everyone, from it not being a topic at all, really, it just really focused all the attention, and everybody were doing research into the effect of neutering. And in the last 10 years, so many papers have come out that have added other conditions to the list. You know, neutered dogs of both genders have a higher risk of allergies, autoimmune diseases, thyroid disease. The list just gets longer and longer. But then what happened is the WSAVA, the World Small Veterinary Animal Veterinary Association, which is an umbrella association that all the different countries' veterinary associations come together, and they formed an expert group to advise on this and to review all the data that was available. And they published this. It's available for everyone. It's the WSAVA guidelines for the control of reproduction in dogs and cats. It's on the wsava.org website. It's obviously written for vets, and it's a very long document, but it's kind of the final verdict, or the verdict for now, at least. This is the world's leading veterinary experts reviewing everything we know in order to make sure that vets all over the world advise on this according to, well, updated, you know, that they have all the information and that they give safe advice. And it's a remarkable read. It really concludes quite clearly that whenever possible, you should leave your dogs intact. Male and female dogs become less healthy if you neuter them. And they introduce, I mean, I find it really interesting and quite funny as well. They introduce a term called an RPO that I have not heard before, which stands for responsible pet owner. And if you are an RPO, you should keep your dog intact. That's what they say. So basically that means that if as a pet owner you are able to look after an intact dog, which primarily means make sure they don't mate, and also just be aware of the health issues that you should be aware of, then it's in the dog's best interest to stay intact. So it shouldn't be a difficult decision, really. I mean, we now know that dogs are better off being left intact. But what that then raises, particularly, I think in the States, where this is such an alien concept, but I certainly get a lot of people contacting me about this from lots of different places, saying, okay, so now it's clear to me that I shouldn't neuter my dogs anymore. I've always done that. So what should we be aware of now? And in terms of female dogs, which was what the question was about, the two main issues are false pregnancies and the fear of womb infections of pyometra. And I think, which was the first one? Which one did you actually ask me to talk about? Should we talk about false pregnancies, or was it pyometra first? I can't hear. Oh, Tina, you've muted yourself.
Whoopsie.
There you are.
I asked for a phantom pregnancy. It was the first.
Phantom pregnancy. Okay. So, and that I think is a really interesting one. A phantom pregnancy has been perceived almost as if not an illness, then at least a syndrome or a problem. But actually, what we call phantom pregnancy is a term for a period a phase in the normal female hormonal cycle. And I think as we get used to living with intact dogs everywhere, I mean, Tina and I are from Norway and Denmark, so we're kind of used to intact dogs. You know, it's not unusual to have intact dogs. It's not that unusual in the UK either, but most are spayed there, though. But when you have an intact dog, you just need to be familiar with their cycle. And I like to draw parallels to humans. I think there are lots of parallels to a woman's cycle and a dog's cycle. And one parallel is certainly that when I was younger, it wasn't something you particularly discussed or talked about or something you were aware of. And I found, someone showed me recently, you probably can't see this. This is a really beautiful piece of art which shows a women's cycle, you know, and it talks about the seasons. You talk about, I've heard young women these days talk about that. I don't know if you've come across that. You talk about spring and summer and autumn and winter, depending on where you are in your menstrual cycle. And dogs go through the exact same thing. And I think that recognizing that if you're a female, you don't feel the same the whole time. And that's completely normal. A male, the hormonal level of a male and the hormonal influence of a male goes like that. You know, they are the same at all points. But if you are a normal female mammal, your hormones will fluctuate and you will feel differently depending on whether you're in a phase where estrogen is dominant or you're in a phase where progesterone is dominant. And what this human wheel shows when it talks about being in autumn or being in winter is the phase where progesterone dominates, and it actually talks about you know, putting on warm socks, and it literally says you will want to build a nest. I generally talk about that phase of a woman's cycle as, you know, you want chocolate and Netflix and a hug and a blanket, and you know, that's how you feel when progesterone is the dominant sexual hormone. And dogs, getting back to the point, that phase for a dog is the phase that we call false pregnancy, the phase after the season, until the time when she would have had puppies if she'd been mated. So there's a huge individual variation, of course, but it's the phase that we call diestrus. A female dog starts having these, I mean, their hormones, once they reach puberty, somewhere between 6 months and 2 years old, earlier in smaller dogs, later in bigger dogs, they will start cycling, and they will have roughly 2 seasons a year. And this what do you call it? There are 4 phases in a female dog's cycle: proestrus and estrus, which are during the heat or the season, anestrus, when nothing happens in between 2 seasons, and diestrus, which is the phase that I'm talking about, the phase after ovulation, the phase that starts late in the season or when the season stops, and then lasts until the time that she would have had her puppies, more or less. So it's those 1 to 2 to 3 months after the season when progesterone is high and when she feels pregnant and when she feels like energy is lower. You become more introvert, more conserving of energy, in a quieter mood, maybe. If you feel like curling up, this is why I talk about chocolate and Netflix, etc., etc. But the point I'm trying to make is that this is a normal phase. It's a normal phase for women, and it's a normal phase for female dogs. And I think the issue is that I suppose we've been living in a male worldview for a long time, and certainly in veterinary medicine it's been a male worldview, so that if your dog seems a little bit subdued or doesn't want to go and race through the agility course, or you know, just wants to cuddle up and becomes a bit clingier maybe, then owners may get concerned and they'll take their dog to the vet, and the vet will say, oh look, they've got milk in their teats, maybe it's a false pregnancy. And it may not be said, but the assumption I find is often that this is a problem. This is something that you suffer from, and this is something that needs treatment. And there is hormonal treatments available, and lots of dogs get these, which I think is a very heavy-handed way to approach a normal phase in a normal animal's normal cycle, you know. So I think a lot of it just comes down to understanding that a false pregnancy is something that all dogs have. Unlike us, I mean, if a woman is after ovulation, if a woman is not pregnant, the progesterone, the ovaries stop producing progesterone very quickly, and we're kind of out of that phase. But a dog stays in that high progesterone phase for well, several months often. So I think my main message is recognizing that all dogs have false pregnancies. All dogs have diestrus, and all dogs have that period of high progesterone, and it will affect them all. It's just that, again, just like women, some are more affected than others, and some you wouldn't know, and others really don't want to go outside because they want to be on the sofa and having cuddles. But I think if we, rather than label it as a problem and treating them with hormones, just recognize what's happening. It's a lot easier to say, oh, you know, you're in your progesterone phase, or you don't need exercise, you need Netflix, and then just, you know, cuddle, give them a kiss, and recognize where they're at, and know that it's completely natural. It happens to all dogs, all female dogs, all intact female dogs, and it will pass by itself. Often it's like just one day to the next, they're out of it. The progesterone's down, they're in anestrus, and they're full of energy, and they want to be outside, and they want to, you know, they just feel different. So that's my main message, is just knowing what's going on, knowing that it's normal, and that their needs are a little bit different. And of course they may clash. If you really want to go and show her, and you want her to be all full of energy and all extrovert and out there, that's bad timing. But I mean, that's life. Knowing what's going on is the main thing, I think. Yeah. And having milk is not, I mean, I think the number of times I've seen dogs actually get mastitis it's so rare. So getting milk is a natural part of that phase. It is thought to be, that's a really nice, nature is just clever. It is thought to happen that way because if you dogs living in packs, and someone needs to be able to hunt, and if only one female is mated, and something happens to her, then all the other females will generally be synchronized, and they'll be in the same hormonal phase, and they'll have milk, and they'll be, you know, wet nurses ready to take over if needed. So they, apart from the fact that they're not pregnant, they kind of are, and they feel it, and the milk is there, and the hormones are there, and everything is geared up for them to feel maternal and to produce milk and to look after puppies. And it's completely normal. So a dog that slows down, maybe doesn't want to eat, doesn't want to go out as much, becomes more clingy and more cuddly and more loving and more introvert, and produces milk, completely normal. It's just that time of the, if not the month, then that time of the 6-month period. So it's having false pregnancies is normal. It can be said as quickly as that.
I think it's assumed that it's a pathology, when in reality it's just a physiological thing that happens with dogs. However, I would mention also, obviously it depends how their symptoms are and like how long it lasts, because obviously it shouldn't be lasting, you know, past kind of 8 weeks, because then you might wonder if there is some problem with the metabolizing the hormones. So if there's something wrong with the liver, if they have hypothyroidism or an underlying issue, that might need to be investigated further. But yeah, like she said, if it's, you know, it's not specifically bothersome, it doesn't last too long, it's completely normal. And yeah.
Yeah, I think the biggest thing to be aware of in terms of pathology is that it happens. When it happens, it obviously happens for that period, the first couple of months after the season, which is also the high risk period for pyometra or womb infections. So there is at least a theoretical risk that you could think, oh, she's not really eating and she's tired and she's sleeping a lot, it's just a false pregnancy. Obviously, you don't want to miss a pyometra. So if the dog feels decidedly ill, then it's better to have them checked out just for the vet to say it's not pyometra, so it must be a false pregnancy. It's fine.
Yeah.
It's always better to check.
I also was mentioned something recently in an endocrine seminar that obviously when the progesterone goes up, also the growth hormone goes up. So actually, it's kind of like the female gets like an acromegaly from the growth hormone. So they can actually start like drinking and urinating more than usual. And obviously that's also a differential when you look at pyometra. So it can be normal, but it can also be a potential pyo. So I guess it's distinguishing the difference. And if you're unsure, you always can check in with a veterinarian, do an ultrasound scan, and
exactly. And if the uterus looks normal, then it's just a false pregnancy, and then go home and cuddle them some more, rather than treat them with hormones.
I think also,
Lise, surely there would be some homeopathic considerations. There might
no, that's a very good point, and I can't believe I didn't say that.
I mean, there's pulsatilla. What is it about pulsatilla? This is like the female. We should have called ourselves the pulsatilla vet sisters, because it's a thing for women, isn't it?
It's all about female energy. There's lots of different remedies that it could be, but it is something that I see quite a lot in the clinic, and I stand by everything I just said, that it's a normal phase. But just like in women, normal hormonal changes can affect some excessively. Just like women can get ill when they, some women get periods or whatever your tendency is or your weak spot is, can flare up when your hormones change, whether it's pregnancy or a period or whatever it is. And similarly, some dogs just overreact to normal hormonal changes, and you don't have to go back that far before the general advice for that was, well, just neuter them. If they feel unwell, or if their allergy flares up or their epilepsy flares up or whatever it could be, that time after their seasons, then we'll just neuter them. But now that we know how dangerous neutering is, that's kind of off the list of options. But I have to say, I always thought that was a very heavy-handed approach to that. And when someone overreacts to normal hormonal changes, homeopathy is fantastic for that. Again, doesn't really matter whether it's in humans or in dogs. Homeopathy is the go-to treatment for anything hormonal, and I do treat a lot of dogs that become ill when their hormones are active, and it's something that's very, very treatable.
And I think also, Tina, you mentioned the endocrine system. So this is also something to consider if the dog is overreacting or having a stronger reaction than is normal. Perhaps then you would look at perhaps how they're, like you said, how they're metabolizing the hormones, how they're methylating, how they're clearing their body and balancing these hormones. And perhaps the homeopathy, perhaps the herbs in the food could help that. I mean, being on fresh food, whether that's raw or lightly cooked, that's going to make a difference. That's going to make it easier on the liver for sure. So these things could perhaps be considered as well if the dog's having an overreaction. And I'm wondering, in your book, is there any support for homeopathy in there for this issue? Lise?
Sure. I mean, there's a chapter in my book about reproduction and about what we just talked about in terms of what we now know about the risks of neutering, and about the normal cycle and about living with intact dogs. The thing about homeopathy that makes it impossible to give general advice is that it really needs to be picked for each specific. There are some remedies, like you say, pulsatilla, sepia, that are almost automatically top of the options, at least when we talk about excessive reactions to hormonal influences, but there are also many others. So the best advice I would give is, if you have a dog I mean, like I said, I think in 90% of the cases, at least, just understanding what's going on. Maybe don't take them training or to shows or insist on very long hikes just for that period, because they don't really feel like it. And I think it's respectful to the dog to appreciate that where she's at, and just to to go with that, really. Even if it may be a different agenda from the one that you know, the human had planned. But if it's an unbalanced response, if you feel that she's not happy, she's not well, and I mean, sometimes dogs do get really ill at this time, and then we need to do something, the best advice I would give is to go and see a homeopathic vet, because homeopathy will absolutely sort this. But it's easy to get disappointed with homeopathy if you try to do it at home. The trick is, the difficult part is finding the right remedy, and that takes a lot of skill and experience. So my best advice would be to go and see a homeopathic vet.
Yeah, I do the exact same when it comes to Chinese.
Or an acupuncturist, maybe.
Yeah. Yes. So yeah, I would say exactly the same with acupuncture, because there's no like cookbook recipes for pseudo pregnancy. You know, that's not really how it works. It's very specified to the specific patient. You know, like, what does their tongue look like? What is their pulse? Like, how is their temperature? Like, how is everything else? And what do they react on back palpation? You know, there's so many variables to set a different diagnosis. So I think if they do have an imbalance generally, I think also acupuncture could potentially help, because it helps to put the neuroendocrine system back into homeostasis. So potentially, you know, if depending on how bad it is, should you do further testing, functional medicine testing, look at the diet, all those things, could consider acupuncture as well. Could help to kind of stabilize and support the immune system and the endocrine system during tough times. There's also in humans, is talking about pseudo pregnancy and the production of milk. There is a few herbs that are used in human medicine to decrease milk production, like things that contain like chickweed and sage and peppermint and parsley and such. There's usually like supplement that combines all these things in human supplements. They can actually also be used for dogs with great success. So I think looking at the dosages with your veterinarian, and then considering trying some supplements as well, it's another thing we can add on there. Yeah, I think we've covered a lot of aspects here.
We have.
And I think that the take-home message from that long talk should be, it is, in my opinion at least, neutering is not suitable. It's not an appropriate response to a dog with false pregnancies. Neutering is not the answer. If things need to be done, there are other things that can be done.
Yeah, absolutely. Surgeons like to cut out everything that doesn't work. So yeah, we further on the questions. Oh, it's 47 already. Let's see, short one. Yeah, so we're basically already on it. So let's also discuss pyometra in intact bitches, because that's also a question.
I funnily enough, I went to a lecture on this last week. So I feel very up to date on this topic. I mean, and you'll know, being a vet in Norway, I mean, pyometra is a common condition. Pyometra means a womb infection. And the symptoms tend to be, the most common symptom is what do you call it? I can't speak English now. Discharge, that's the word I'm looking for. The most common symptoms are discharge from the vulva. You don't always have that, but it's the most common one. And then just a sort of lethargy and being off color, maybe not wanting to eat, you know, not feeling well. Yeah, and it's it's what we call a disease with a high morbidity but a low mortality. So it's something that happens quite commonly, but it's something that actually very few dogs die from. But there is an element of fear, and I think particularly in the States, because the pressure has been on for so long that you must spay and neuter, it's kind of been used as a little bit of fear mongering. You know, you need to neuter, otherwise they get pyometra. And to me, that argument is just crazy from the outset. I mean, to remove an organ for fear that it may in the future become ill is crazy. I mean, we could all have our appendixes out just right now then, because then we don't get appendicitis, or we could remove our breasts. So I mean, it's madness to think like that, I think. But I understand the conditioning that goes behind it and the history behind it. But I think if you just pause and think, well, if the body is healthy, we don't start chopping bits out that may become ill in the future. What we do is we observe for symptoms, as we all do all the time anyway, in ourselves and in our animals. And if something is off or we're worried about something, then we get it checked. Pyometra used to be an automatic womb removal. These days, it's also become quite common to treat it with drugs. You can treat it with there's an antiprogesterone hormone treatment you can give together with antibiotics, and most dogs can be cured that way. In some cases, surgery is still the answer. And the stat that I heard last week is obviously it's the more severe cases where you operate. And the stats on the surgery, one point that was made at this lecture I just went to is that it's very much down to surgeon skill. So vets that are used to this operation, is completely routine. And, in Scandinavia, it is completely routine. I mean, I've seen 2 dogs with pyo this week, and they were actually both put down for surgery, but it wasn't even, I don't do that anymore, but the vets who were going to operate on them were saying, well, we'll book them in for Friday. It wasn't, they were not very ill, and it wasn't an emergency. They can wait for 4 or 5 days and then we'll neuter, because that was the decision that was reached. But it's not dramatic. That's the point. And what I was trying to say is the stats show that of the dogs that are operated for pyometra, where you remove the womb, so that's obviously the dogs that are the illest, the worst cases, the most serious cases, 0.45% die. So that means 99.55% survive. So it's actually a disease where even those that are very badly affected and need surgery are 99.5% likely to survive and be absolutely 100%. I mean, once the womb is removed, they're completely recovered. So the fear-mongering is not based on anything. Yes, it can happen, and someone will say, oh, but my dog died of pyo 10 years ago. Of course, it happens. But if you know the signs, and if it's diagnosed, and if you're, it can be, many cases can be treated with drugs. The dogs will be absolutely fine. It may recur, something like 10 or 20% may recur, and after future seasons. If you operate and take the womb away, obviously it won't recur because there won't be a womb anymore, and then there are more than 99% likely to recover and be absolutely fine. So it doesn't deserve the bad rep. It's not something to lie awake at night and worry about. But if you have an intact dog and you see a discharge from the vulva outside of the season, then obviously take them to a vet.
Good.
Yeah.
I also want to refer to one study. I think it was Connor who shared it. There was a study where they were checking the abundance of different E. coli species around the anus of bitches, and they actually found that the kibble-fed dogs had a higher abundance of more pathological E. coli bacteria than the ones that were raw-fed. And I just thought that was an interesting take. Like, what does that mean for, feeding and the risk of actually getting pyometra? I think it would be very cool to have a study on that.
Yes.
There was
Sorry, didn't mean to interrupt.
You go on. You go on.
No, I was just going to say another interesting fact about pyometra is that there is a huge difference in the risks. Some breeds there is some genetic part of the tendency. Some breeds, particularly large breeds, get it much more commonly. Bernese mountain dogs are very likely to get it. Great Danes. I don't know why giant dogs have a higher risk, but it seems that they do. In golden retrievers, they have isolated a gene that predisposes them to pyometra. So there is some genetics there as well. But it's just something, if you have an intact dog, it's something to be aware of. And if you're concerned about it, it's always better to check. That your vet can do an ultrasound scan and or a blood test, and they can tell you if it's pyometra, and then they can treat it. So it happens, but it's treatable, and it's very, very, very rarely fatal. That's what I would say about that.
Is it linked with a predisposition to inflammation then? Because when you said that about golden retrievers, I was like, wow, red flag. They're one of the most likely to have
to have most things. There are some breeds like that.
Inflammatory, issues. Yeah, I mean, I like to think it's changing now, but perhaps it's not. So yeah, it's interesting it's gone so far as actually becoming something genetically within.
Yeah, yeah. And golden retrievers aren't in the top 10 breeds for pyometra, but they, as far as I'm aware, that's the breed where they've identified the gene. But I mean, Bernese mountain dogs, but again, they tip the risk list of most diseases as well. But I don't know why large dogs have more pyometra. And the professors that were lecturing about this last week didn't know either. But it's certainly a thing that not all breeds have the same risk. My main message would be it's something to be aware of. If you're worried, always go and get your dog checked, but it's really not something to lie awake at night worrying about, and it's definitely not something to neuter for fear of at all.
So interesting that we're here as the Holistic Vet Sisters, and we spoke a lot about female problems today, haven't we? That's the intention.
Well, Holistic Vet Sisters.
Yeah, exactly. So Tina, I don't know what the questions are like. We've only got a few more minutes, but I'm wondering whether we can maybe have a look at some of the questions, and these are the things we'll be chatting about next week, perhaps.
Yes, let's talk about it. So we've got quite a lot of questions in all directions here, but next week we already got a few questions. If you have any more, feel free to write them on our Facebook page under this live, for example, and we'll check it. We also had questions regarding cancer in dogs and how to support them holistically and holistic treatment and diet. We had questions about neutering of cats because we talked a lot about, dogs.
Oh, I can answer that one in 2 seconds, really, which is a lot more research is needed, but the advice everywhere is that we still neuter cats. All this talk about not neutering is dogs. Cats need neutering, and we can talk more about that if there are anybody who wants more information about that. But the bottom line is, yes, we still neuter cats.
And would they not have the same growth hormone impact then? Or is this
there are indications that they do, but it's just the alternatives are worse.
Right, yeah.
I mean, you can't let cats outside if they're not neutered. They're gonna get pregnant, they're gonna fight, they're gonna stray and get hit by cars. It's just not safe to let a cat out that's not neutered. But even if they're indoor cats and who never go out, the male tend to, I mean, they also smell around intact cats. Once they mature, it's not for everybody, and they will often even start spraying and urine marking their territory. And at that point, if you neuter them, they may not stop that behavior. So I would generally say if you have a single cat who's a male and who's never goes outside, and you trust your family to keep windows and doors shut so it doesn't happen accidentally, I would delay neutering him till he's maybe 9, 10, 11 months old, so that he has a chance to develop fully. But then I would do it before he turns a year or around that time. Female cats, when they start getting their cycles, it's a big thing. They will be driving themselves and everyone around them crazy. They throw themselves on the floor, they howl, they meow. They're very full on when they're on heat, and they go straight from one to another. And often owners think the cat's ill because their behavior is so extreme, or can be. So
I actually have an intact female indoor.
You do have an intact female?
Yeah, I do.
How old is she?
She's like 5 now, or 6.
Oh, but I take everything back. Tina, talk to us about cats.
No, obviously, no. I can see why people want to do it. Obviously, it is a lot when they are in, that time of time of half a year. But I think, I don't know, she's been a very healthy cat. But she does go outside, but in the leash, which works very well for her. And we live in a very trafficked area, so we put her out in the lead and we walk her sometimes, and she has outdoor time, but obviously won't get pregnant because we're watching her. And I think that works really well for me. But again, that comes very much down to the individual family, and obviously if you have your cat outside, you can't leave them intact. And also I think the studies supporting castration of cats is not the same as it is with dogs. Like, we generally have connected all these issues more to spaying and neutering more so than we have in cats. However, I do want to mention that obviously there is a huge change in their body overall. Like, I don't know if you've ever injected a castrated cat compared to an intact cat. Like, the entire skin integrity is completely different. So obviously there are things happening in the body. So, but yeah, again, it depends on convenience if you're having them outdoors, and spraying in male cats can obviously be an issue. So I think it depends. It's usually my
Yeah,
answer.
it depends. Yeah, exactly. It depends.
Okay, so next week we've got to chat
Yeah,
about
sorry.
cancer in animals, I think.
Cancer, yeah, we basically talked about sterilization. So, and then cryptorchid, animals, natural flea treatments, support for animals that are already castrated while young. I had also a question about feeding bumble feet to dogs.
Bumble feet.
Bumble feet, you know, when the chicken get inflammation in their.
Oh, that's interesting.
Yeah. So yeah, but there are continuous questions coming in. So if you
Well,
have
that's
it,
great. It's nice that someone is out there and someone is listening. That's we would feel a bit silly
Someone's
anyway
enjoying
if
it.
wouldn't
Yeah.
we? Yeah.
Okay, that's cool. That's cool. Okay, so we will come back next week at the same time, won't we? And answer
Yes, we will.
questions.
And maybe we'll have a guest. Hopefully we'll have a guest.
We might do, yes. Yes, we might do. That'll be a nice surprise for everyone.
Yeah.
Okay, and in the meantime, do go look up Lise's book and do have a look at naturaldogexpo.com.
Could you put a link to that on the Holistic Vet Sisters page?
Yeah, I'll put it under this video and I'll put it on the page as well. We do have people coming from all over the world, so don't think that you're too far to come to the Natural Dog Expo, because there's not many Natural Dog Expos. I don't know of another one in Scandinavia at all. Perhaps there's
no, and there were people from Scandinavia when I was there, other than me. So no, it's definitely worth. It's nice. Yeah, I would suggest that as a Christmas present for anyone who needs a weekend away and love dogs.
Okie doke. Right, we will be back this time next week. And thank you for making the first one interesting for us all and for everybody watching.
Thank you for all your questions.
Yeah,
absolutely. Yeah.